It's time for your phone calls, your questions, and your comments. It's time for the Urban Scene with Don Frierson.
And good afternoon. Welcome to the first program of the new year for our weekend edition of the Urban Scene. Actually, it's the second program. Boy, I'm getting my dates and times confused. But regardless of what program it is, I am honored and excited to have this guest with us, Dr. Macie Smith. And I have not talked to her in a long time, and I'm excited to be talking to her today. Dr. Smith, hello, how are you?
Hello, Don. It has been a long time. It is so good to hear your voice.
It sure is. We used to talk all the time, but we sort of lost connections, and because you always have valuable information, and we're going to straighten that out this year for sure.
Well, we have to. I thought you was acting funny, brand new and whatnot.
Well, I'm not going to tell you what I thought. I thought that I'd done something or something, but friendships never die, so we're good friends. So,
of course, never did. So, but you know what, Don? It's so ironic that you opened up the show with. You forgot what show this was in terms of, is it the first show or the second show? It seemed like you got a little nervous around me because of what I do and who I am.
Well, I'm going to let you.
Don, people don't want to forget around me because they think I'm looking at them.
And you know what? I thought about that too. I said, golly, now she's going to try to diagnose me on the air or something. Tell us what is it that you do and what are we talking about today?
Okay, great. So it's always ideal to reintroduce myself to your audience. I'm Dr. Macie Smith. I'm a licensed social worker and a gerontologist. I specialize in working with the aging population and their family caregivers. I also work with professionals working with the aging population, and that would be geriatricians, other social workers, and community care managers. I do specialize in working with families who are caring for those with Alzheimer's, dementia, or just age-related illnesses. I help to coordinate and identify support services after I do an assessment of the situation. And families really do appreciate that, Don, because whenever there's a daughter or a son or a niece or grandchild, they wind up in the position of a caregiver. Unbeknownst to them, Medicare does not cover the supports and the long-term care services that their loved one needs. And so they just need some direction. And that's when they call Dr. Macie.
Now, prior to coming on the air, you mentioned Antonio Brown. Talk about that for a few minutes. As you know, he played with the Tampa Bay Buccaneers and he took off his shirt and left the stadium last week. Talk about that and the ramifications of how we view that. And
yes, I think it definitely was a traumatic exit. I don't follow football. My husband watches football, so of course I have to be the good wife and pretend like I'm watching too. Sometimes that's some quality time we can spend together. And when Antonio Brown abruptly left the Buccaneers game last week, there was just a lot of information swirling. One of the biggest things that we heard was mental illness. So, I don't know. It's really hard to diagnose someone if they're not in your care. You know what I mean? But
right.
That does not negate the fact that when you're in the public eye, and sometimes when you're not, you are at the mercy of public opinion and public ridicule and a public diagnosis of mental illness. Why, when somebody walks off their job, it's mental illness? I know that he's had some concerns with other things that he's been involved with in the past in terms of how he responds to things. But I think that we have to be very careful about diagnosing, whether it's a professional diagnosis or a non-professional diagnosis of mental illness, because that may not be the situation. Man, the man just might not have wanted to work for the Buccaneers anymore.
Well, he had an incident when he was with the Pittsburgh Steelers where he took a blow to the head. And some people said he has not been right since, and they say it's CTE. Now, doctors have said they don't think that's what the situation is. But, you know, when you talk about mental illness and people do unexpected things, then naturally the thought is, well, something must be wrong upstairs.
Right. You know, and that is a natural thought, especially when people do things that are atypical or non-typical of what the average person would do in a particular situation. But everybody is different. And I do know that, you know, he had a situation of domestic violence.
He did.
So whenever there's situations where someone is hurting someone else, there could be some trauma up there. Living with trauma or dealing with trauma or not dealing with it, suppressing it, does that mean that you have a mental illness? Now, granted, the DSM-5, that's where many different disorders are listed, Don, where clinicians and physicians may diagnose someone with some type of personal disorder, right? Or condition. If you go to that DSM-5, and that's how they clinicians bill insurances and stuff like that, by diagnosing someone with a particular disorder, you're probably going to identify something that you're dealing with in that particular manual, because sometimes I deal with obsessive compulsive disorder behaviors, OCD. So again, we really have to be careful about, okay, it's a mental illness. Well, maybe it's not. Maybe it's a bad day, right? And you mentioned about the blow to the head. So CTE, let's define what that actually is. So CTE stands for chronic traumatic encephalopathy, is what it is. It is a condition that has been around for centuries, Don. And in fact, it is, because it's a neurodegenerative disease, it does share research space with Alzheimer's disease and progressive types of dementia, because it does involve brain damage. Now, someone can develop CTE because of repeated blows to the head, right? So we think about our athletes, and CTE typically is associated with athletes and soldiers. Why do you think that is, Don?
Well, I know athletes, especially boxers, take a huge amount of blows to the head, and contact sports like hockey and football.
Yep.
Now,
Soccer.
soldiers, soccer also. Now, soldiers, I guess it could be because of the percussive nature of being around bombs and things.
That's right. And it's head trauma. And with that head trauma, again, we'll say with soldiers with PTSD, post-traumatic stress disorder. And so just say with Antonio Brown, with the blow that he's had to the head, one blow is not going to cause CTE. It has to be multiple blows to the head that has impacted the actual brain, right? So for example, there are different levels of concussion. You got mild concussions, severe concussions. You can have a concussion that does not knock you out at all. You can have a blow to the head that does not knock you out at all, but the jarring of the brain and the head after it's been hit causes damage over time. So typically CTE is diagnosed in the early 20s and 30s, because usually our players, they don't start playing football at 20 and 30. They start playing football at what, Don?
Six, Pop Warner, 10, 6, 7, 10 years old, yeah.
Pop Warner. So, you know, and I'm not saying this to say that kids shouldn't play football. However, when parents sign their children up to play football, they need to be well aware of what some of the ramifications are, Don, because what happens is when these NFL players and college players, when they retire from the sport, families are not prepared for CTE. They don't even know what it is. They've never even heard of it. And I know that now that the football league, they do concussion protocol.
Right.
Don, I remember back in the day, somebody would get hit, get knocked off, and they'll go right back into the game within the next minute or two.
Mm-hmm.
But now they do the concussion protocol, and sometimes they take the guys out of the game. And the player themselves, a lot of times they get upset. But we all have a responsibility. If we're going to manage in any level at all when it comes to contact sports, and it involves the head and the brain. We have to be knowledgeable so that way players have the information and can make informed decisions, but also families, because ultimately the responsibility is going to fall on them.
Right. We're talking with Dr. Smith, Dr. Macie Smith, on this weekend edition of the Urban Scene, talking about Antonio Brown, CTE, mental illness. Here is what I thought, and I saw the blow. It was a vicious blow. It was really unwarranted. It was he was literally defenseless when he was hit in the head. But the fact that some people might not want to say he has a mental illness, and you know what they say in the African American community, that this is an issue that we don't want to confront or admit to. So by saying, well, it's probably not mental illness, does that go down that track that we've had in the African American community of not wanting to confront mental illness?
It could be. I feel like we as a people, we go from one extreme to the next, either, oh, it's mental illness or he's having a bad day, as opposed to ruling out reasonable reasons or justifications as to why these behaviors occur, right? So if it's something that's concerning, Dawn, it needs to be we need to look at if it's a medical cause. If it's not a medical cause, then it could be a mental illness cause. What I want to relay is to not automatically assume one thing, because if you assume one thing, then you're going to not address the other thing. And that might be what the issue is. CTE is not a mental illness. It is a medical condition. It's a neurodegenerative condition. And so if you go straight to, oh, that's a mental illness, how do you treat mental illness? I mean, you treat it with medication, you treat it with counseling, but you got to figure out what the root cause is. And I'm not saying that that's the NFL's responsibility to do. That is Antonio Brown's responsibility to do, and those who love him and share his space. So I'm not saying not to negate that or not even to consider it, but we have to be knowledgeable enough to consider all the key facets that could go into play. And you said that he had a vicious blow. That was just the one that you saw. Now he's had several, all football players have several blows that don't even, render them unconscious. But that continual contact sport increases their risk of developing CTE, chronic traumatic encephalopathy, which is typically diagnosed upon athletes and veterans. And you know what, Don, you talked about boxers. They're in the world of dementia and Alzheimer's. When we talk about progressive types of dementia, there is a type of dementia called the punch drunk syndrome.
Right.
From boxers, boxing.
So,
and
yes, go ahead.
But you have to consider what some of the signs and symptoms are. So I think that's important to know too. Now, one key element here, when people are saying it must be CTE, the only way to determine or to diagnose someone conclusively with CTE is on autopsy. And that's what was done for, I think the guy's name is Adam Phillips, the one who, the former NFL player who killed those 6 people in Charlotte.
Right. No, I think that was in Rock Hill.
Oh, Rock Hill.
Yeah, that's Rock Hill, South Carolina.
Yeah, that's Rock Hill, South Carolina.
Yeah, and as you said, CTE can only be diagnosed after someone has passed away and they do a brain, whatever they do, autopsy on the brain. Mm-hmm. And it was discovered that he indeed did have CTE. So when you look at Antonio Brown, well, you might talk about CTE, but really all it is speculation because you really don't know.
Right. And so when you make those speculations, then again, so at this point in time, you're focusing on a particular area while overlooking maybe the real root cause, and he's not getting the support that he needs. And so, I'm very careful when I say don't even consider that to be mental illness. I just don't think it should be the first option.
Well, let me give you this example. I mean, you know me, we've been knowing each other for a while. If it came out that I did something strange that's totally unlike the person you know, what would you think?
So I'm going to think, as a gerontologist, I'm going to think medical first.
Mm-hmm.
The reason I'm going to think medical first is because research supports this too, hands down, that either people are not treating or addressing their medical condition. Either they're in denial, or they don't recognize the signs and symptoms, or they're mistaking those signs and symptoms for something else. What happens is, whatever that medical condition may be, it is progressing and it's manifesting, and it's going to affect a person's brain. It's going to affect their cognitive ability, because a lot of times we don't even consider a person's brain when we're considering their physical health, if that makes sense. Now, once medical is ruled out, then the next step would be, mental health, not necessarily mental illness, but mental health. Everybody has mental health, needs to have mental health awareness, because all of us have a psyche, all of us have a brain, all of us has mental, and we want to make sure that our mental is healthy. Like we address our physical health, we have to address our mental health. And in society, when somebody says mental health, we automatically think mental illness. Am I wrong or right about that?
You're right, and that's the problem. Mental illness carries with it a stigma.
A stigma,
which is a shame, because, as you said before, we have a mental side and a physical side. So when you look at what happened to Antonio Brown, if he has a mental problem, it might be a situation where he don't want to, I guess, acknowledge that because of the stigma it carries.
That is true. So, there are a lot of factors that we have to consider. I just don't want mental illness, even the term. We have to change the negative connotation of the term, because you think mental and then you have illness. Don, just think about how that sounds. Mental illness, that means your mind is ill, your mind is sick, but that may not be the situation. You may have mental health concerns. You see the difference, the way those two things sound: mental illness and mental health concerns.
Yeah. Uh-huh.
You see what I'm saying?
Mm-hmm.
When someone is having mental challenges, and any of us can have mental challenges at any given point in time. Think about this pandemic. There have been situations where I have been depressed, right? And we're talking about a functional depression, because I was still functioning. I wasn't in a bed or anything, but that's something that the entire world was dealing with.
Right.
We didn't call it mental illness, because I don't think that we should have. We should call it mental health concerns. Now, what mental health concern are you having? What's bothering your mental? What's bothering your psyche? What's bothering your well-being, which includes your mental health, your mental health. So how we define it, how we refer to it, and how we support it, I think, Don, is going to help reduce that stigma. But I think you're spot on. It should be a part of the routine protocol. For example, if you have a headache, Don, the very first thing typical people will do, well, I'm from the country, Don, I'm from North and Norway. So the very first thing my mama going to tell me to do is lay down.
Yeah, right. Yep. Mm-hmm.
Right. So what happens is, when you have an ailment or something, you're experiencing something different. Like you just said, if you do something that's out of the ordinary and that's not you, I'm thinking you're saying that the average person is going to think you have a mental illness. I'm not, because mental illness does not happen overnight. It just does not. You don't go to bed the day before, you're fine, and the next day you have a full-blown mental illness. It just doesn't work that way. It may have been something manifesting altogether. So once we do our ruling out different causes as a part of our daily regimen or routine regimen, just like when you have a headache, you're going to try different things. You're going to go to sleep, and then you may take some over-the-counter pain medication, or you're going to take a bath in some Epsom salt, or you're going to, rub your head down with some alcohol. So see how you're trying all these different things to address your physical health?
Right.
We have to do the exact same thing for our mental health. So you have a headache, you're not going to automatically say, oh, I got a brain bleed, I got an aneurysm, I got brain cancer. You see what I'm saying?
Mm-hmm.
So why, when someone is having a bad day or having an emotional state, why do they have to have a full-blown mental illness? I'm just talking. I'm just saying.
So, if I understand you correctly, going back to the example of me doing something that I wouldn't ordinarily do, it doesn't mean that I have schizophrenia or that I'm paranoid. It could mean that there are some mental health concerns that I need to have addressed, but I don't know how to have them addressed. Is that
Correct. Right. And again, I don't care what the situation is, we have to address the cause of these things. Whatever is ailing us, we have to figure out the cause of it. Now, in your situation, somebody's just acting erratically different, right?
mm-hmm.
And it may be a mental health concern. You have to consider that because that's a part of your physical health. But we got to figure out, so what is causing him to act this way? I can almost, I don't want to put a percentage on it, but a large percentage may be related to something medical.
Mm-hmm.
Depression is medical as well as mental, physical health as well as mental health. Medical care, because you may take medication to address your depression. You're also going to address your depression maybe with talk therapy with a clinician or with someone from the church. So you're treating it with medication, which is medical, but you're also treating it with talk therapy, which is social. You see what I'm saying? So as people, we're not monolithic. We are multi-layered. And so if we're multi-layered, if we have an ailment or a concern, we have to address different facets of who we are as a human being.
Right. My mental health concern could be you and I talking and you notice I don't follow you, or I'm just not looking at you when I talk to you, or I'm not focusing on what you are saying. It does not mean that I have schizophrenia, but it definitely means that there's a concern. Now, if that concern is not addressed, could it lead to mental illness?
Oh, absolutely. It absolutely could. And the research bears this out as well. Just think about someone who may have chronic pain. They may have chronic arthritis, or they may have neuropathy. And because of that pain, and they cannot get relief for that pain, it's impeding their ability to do things they love to do things with people who they love. So that may cause depression. It may cause anxiety. It may cause, various disorders that was brought upon because of a medical condition, right? So, someone just say may have a personality disorder or they may have schizophrenia. They didn't get that overnight. There were signs and symptoms early on. I don't know how early on, but there were signs and symptoms early on, may have even been as children. And to your point, Don, especially in the African American community, we may not address it when we see it as a parent or as an adult. We may not address it when we see it because they're so young and we're in denial and we don't want the person to be treated differently, but they didn't get the treatment that they needed at a younger age. And so it's manifesting. So, we have to talk about mental health just like we talk about physical health. And I think if we start to have that natural conversation, that we can shift the narrative, not necessarily change it, but just to shift it a bit to be inclusive of our conversations. So for example, the other day, and I'm just going to be honest, I took my daughter in for her 12-year-old visit, Don. So they give you this list of things that you should talk to your children about at certain ages and what you should look out for. So there was a questionnaire, and the questionnaire asked me, does your child think about hurting him or herself? Does your child ever say that he or she wants to hurt themselves? How often is your child crying? And so, first of all, I don't know if my child thinks about hurting herself unless I do what?
Ask her.
Ask her, right?
Mm-hmm.
And so as I was reading it, I could have easily have said no, because number one, she never said it to me, and I'm not prepared for it. I'm not prepared to deal with it, so I'm gonna check no. Or either I said to myself, okay, I don't know the answer to this. I need to ask her. But a part of me said, Don, if I ask her, she might start thinking about it. And so I said, first of all, that is an immature way to think. However, it's a realistic way to think.
But it's also how you ask her, too.
Mm-hmm. Say that again?
Now, it's also how you ask her.
Right. And so I said to myself, to weigh the risks and the benefits there, if I don't ask her and she's experiencing this, then she could commit suicide. And that risk outweighed the benefits of me not asking her, if that makes sense. So I asked her and she was like, no. She was like looking at me like, why would you ask me that? And I said, I have to ask you that because I don't know what you're feeling and what you're experiencing. But can you imagine the parents that don't ask their children that because they don't want to, they don't want to encourage that type of thinking, but I don't think that they're not weighing the benefits of and the risks of not asking.
Boy, we almost out of time. I could carry this on for another hour. But how important is it to have somebody to talk to?
Oh my gosh. I think it is right up there with getting your annual physical.
Really?
Getting your annual physical to prevent medical conditions and mental health conditions from occurring and developing. That is just as important to having someone that you trust. Because you can't just be going out there talking to just anybody.
Right, that's what I mean. Somebody you can share your secrets with.
Don, we can't talk about this all day long.
That's going to wrap it up for the weekend edition of The Urban Scene. I'm Don Frierson. We have been talking with Dr. Macie Smith. It's been a pleasure talking with her. See you back here next Sunday.
Thank you, Don.
Sure.